If your child is showing signs of difficulty breathing, is breathing fast or hard, has very pale or blue skin, is sweating, or if a squeaky whistling noise is coming from the tracheostomy, first attempt to clear the airway. If the child is gray, lifeless, and non-responsive, immediately begin CPR, beginning with chest compressions. Begin by suctioning. If you can't pass the suction catheter, immediately perform a tracheostomy tube exchange. Give supplemental oxygen if necessary, and call 911 if the child does not recover. After the trach change, check the tracheostomy is clear by giving breaths with your ambu bag. You should be able to see your child's chest rise if the obstruction has been cleared. Continue to begin CPR if the child remains unresponsive. If you are alone and must perform CPR, first look, listen, and feel for breathing. Gasping is not normal. Perform 5 cycles of CPR, 30 compressions to 2 breaths with the ambu bag. Then, call 911 and place them on speaker. If someone is available to aid in CPR, perform continuous compressions. Have the other person administer breaths with the ambu bag every 6 to 7 seconds. Switch when fatigued. Next, deliver 2 breaths with your ambu bag. Make sure that you deliver enough air to see the chest rise. Allow 1 second for each breath. You can also utilize the ambu bag along with a mask attachment by placing a 4x4 square of gauze over the stoma. Then, place the narrow portion of the mask over the child's nose. For infants, locate the nipple line. Place 2 fingers just below the nipple line. Push hard and fast, compressing to a depth of 1.5 inches. For children between 1 and 8 years old, place the heel of one hand in the center of the chest, between the nipples. Push hard and fast, compressing to a depth of 1.5 to 2 inches. For children above 8 years old, place the heel of your hand in the center of the chest, between the nipples. Place your other hand on top and interlace your fingers. Push hard and fast, compressing 2 inches. Compress at a rate of 100 to 120 beats per minute. Sing a song in your head, such as Staying Alive or Dancing Queen, to keep yourself on beat. Ensure that you allow the chest to fully rise before your next compression. Be sure to count out loud as you perform compressions. Every 30 compressions, stop and perform 2 rescue breaths with the ambu bag or with another method if the trach was unable to be replaced. Allow 1 second per breath. Continue cycling from 30 compressions to 2 breaths until the child becomes responsive or until help arrives.